Good morning and warm welcome to everyone joining us today. I'm your host Dalvinder Kaur from lovely Professional University. We are excited to have you with us today. So sit back, relax, and let's dive into today's topic, that is career opportunities in allied health sciences. Before we proceed further, allow me to introduce the expert of the day. Dr. Naresh Kumar, Associate Professor and Head of Laboratory in the Department of Medical Laboratory Sciences, Lovely Professional University. With 17 years of teaching experience, he has authored 3 books, 6 book chapters, and 20 research papers in reputed journals. He has guided over 30 master students and more. So now I would like to introduce the admission nominee also in this webinar, Mr. Bhuvan Serene, Assistant Director at the Department of Tie-Ups, East 1 Region, with expertise in forging partnerships and empowering students through career counseling. Before we proceed further in today's session, I would like to request everyone for any questions you can write in the chat box or in the Q&A box, and same will be addressed from my side in the end of this webinar. Now I'm going to hand over this session to our expert, Dr. Naresh Kumar, and it would be an absolute delight to listen from him. Over to you, Dr. Naresh Kumar.
Okay, thank you so much, ma'am, and good morning to everyone. So today I'm going to talk about the future prospectus or the career opportunities in the medical laboratory sciences. Okay, so there are in allied health sciences or the medical laboratory sciences or any other profession which is related to the medical science other than the particular medical subjects, means MBBS or the MD. So here the allied medical sciences which has several courses, and in LPU as we have the DMLTs also, BSc MLT also, masters also, and clinical embryology and operation theater technology and optometry. So these what are the basically prospectus after doing this one, how the people can go ahead after finishing their degree or the diploma or the masters or the PhD. So what is their future and what is their career opportunities here in India and abroad also. So as I talk about that, there are the now newly introduced one more courses, clinical embryology as well as the operation theater and optometry. So today I'm going to talk about that also. So here that what is the medical laboratory sciences? As you know that it's a kind of medical laboratory sciences in a short form. We also know that it's a diagnostic center or the medical laboratory sciences people. They are dealing with the fluids. So the fluids is was basically fluids or the material or biological material which has been taken from the body. So as such, the medical laboratory sciences or the clinical laboratory, both are the same word. There should not be any confusion to anyone. So the clinical sample which has been taken out of our body, sent to the laboratory for the checking. So as you know that our body is, you know that it has a blood and the blood having the another composition also. So whatever the problem what is going to be taken place, primarily there would be some changes what takes place in a blood or in a fluid. So that's why the medical laboratory sciences are going to take the samples. They are going to take the samples from the different part in a different diseases. And then finally it is diagnosed for what is the problem with the patients. And after once the diagnosis is done right, the treatment would be fine. If the treatment is if the diagnosis is wrong, treatment definitely is going to be wrong. So that's why the medical laboratory sciences, the people who are investigate for the diseases the person may have. So here the medical laboratory, that how much it is in a size. As such, we have the different size of its according to their complexity, because it containing almost 10 to 15 different subject, 10 to 15 different kind of laboratories. It's becoming a more complicated. Reason behind it, because instead of the too much science and too much investigation and too much new things are coming in the market, still we are behind the diagnosis of the disease. So most comprehensive and the commercial laboratories, they are a different level. If the person who has done the Bachelor of Medical Laboratory Sciences or the DMLT and the master, they want to open their laboratory, they can start with the small size also. I'll tell you the one interesting thing. It doesn't mean that they require a lot of funds. They can start their own small laboratory if they don't want to go for the job within a 1 lakh rupees. But the number of the tests would be low. Number of the tests would be less. Means 10 to 15 tests you can start with sugar, blood sugar, or urea, creatinine, or CBC. This kind of the things very small. And once you are growing with the samples, definitely you can increase your laboratory capacity. You can get the more automated system also, and slowly it can grow to the high level. So these medical laboratory sciences basically discipline experience in a fastest growing. Why it is the fastest growing? Because you know that in the whole world, whatever the disease were 2 decades before or 3 decades before, now almost 3 to 4 times it has been increased. So that's why the people want immediate diagnosis, immediate treatment can be started, and there's a lot of competition in that one. Now how these people, after doing this bachelor degree or the master, what is the designation of that? Sometimes the people may asking what is the job responsibility, what they are going to call, what they would be actually. So the person who is biochemist, clinical microbiologist, laboratory assistant, biomedical scientist, we have in India and outside of the India and the different countries, we have the different kind of the designations. In India, we have the junior lab technician, senior lab technician, medical technologist, and junior scientific officer and the supervisor. So these are the designation which is given in a hospital. Medical laboratory scientific officer also, phlebotomist. Nowadays, as you know, that too much samples are there. That's why there are some people who are expert only collection of the blood. So they are not going to collect all, simply they are going to collect the sample. Throughout the day they are busy. Just imagine if on a one you are in a good hospital, there are the 3 to 400 samples are coming per day. Just imagine if you are spending the 5 minutes over the one patient, that how much is going to be busy, how much is going to be, they're going to spend the time. That's why the one phlebotomist team is now separate. Histology technician. I'll tell you a little bit what is the histology technician. They are basically when somebody having the problem with the tumor, and they have the swelling in any part of the body, or they are taking the some part of your body. So when it is sent to the laboratory, in a laboratory they are going to process it, and finally they are going to cut the small slices, very thin sectioning, and then we are going to do the further processing, and we are able to find whether the patient having the cancer or not. So for your that knowledge, I want to tell you one thing. Tumor is not a malignant, tumor is not a cancer. So tumor can be a non-malignant. How do we know it? With the help of the laboratory testing. That's why the diagnosis is first is required to treat any kind of the disease. Scientific officer who are deal with the all kind of the testing, medical technologist, the person who having almost after the 10 years they have the good experience in a one hospital, they become the medical technologist. Medical laboratory scientific officer is a kind of the person who having the little bit more experience in a machinery system also. They can do the troubleshooting also, that known as the medical scientific officer. Application manager. And now in laboratory sciences, as you know, there was a manual technique. They are taking the sample, then reagent they are adding, and finally doing. But nowadays people want very fast. So ultimately, whatever the test we are doing earlier, it was taking almost 15 to 20 minutes in a very fast in a manual. But nowadays in a 1 minute you can get the report. So this is how much through the machinery that automation has come, it made the diagnosis fast also. So the people who install the machine, who tell them what is the functioning, and they tell them what is the quality and what is the reproducibility of the result, they are the application manager. Who can become this one? The person who has a good experience after the BSc medical or the master degree. Sales and the executive biomedical instrument, you know that as the instrumentation flood is there throughout the market, throughout the world, day by day new instruments are coming up. Nowadays the smallest one, earlier it was a big one, now a small one instruments are coming, they are keeping along with the bedside, where the patient is there very serious. It may be the after every hour we want to check the test of the patient, so they can take immediately can do. So even they want to decrease the time, sample taking, sending to the hospital, then they are giving the reports, almost take 1 hour. But if we just decrease that time also, the patient treatment can be done fast. So as we are growing day by day, treatment is also fine, fast, diagnosis is also fast. So the clinical laboratories are the supplies that the multinational companies, we have the different companies, Thermo Fisher, very good, who have the $47 billion. life sciences, they are providing the instrument to us. So not only the person having the opportunities in doing the testing, they have the multi-dimensional opportunities after completing their degrees. So simply, I'm just showing this one: Roche Diagnosis, Abbott, Johnson and Johnson, Beckman, molecular diagnosis, where we are just doing the DNA level of kind of the testing into that blood transfusion, है So all these testing is done by the multinational companies who having the high billion. You just said dollar 61.22. Now it is become more even, right? So there are the machine, the person who operate it. These are the machine, program machine. AI system nowadays is coming up. Simply that you put the sample, machine is going to take the sample, thoroughly is going to run. Simply give the command what test you need at what time you need. So all the prompting, if you're going to give within a 1 hour, you can get a lot of reports, hundreds of the reports, very fast way you can get through this machine. Yes, of course, it's highly costly, and it doesn't mean the one person has to buy it. No, if you have the good number of the samples in your laboratory, company is providing free of cost, but this is the agreement that you have to buy the reagent from them till the instrument is till the instrument is installed over there. So once the age is 10 to 15 year or 20 year, till there the person has to take the reagent from the same company, and they can give this 50-60 lakh rupees of the instrument free of cost to everyone. All right. So this is the one that how much the progress is happening in this one. So we have the hematology. Now hematology is what basically, this is the one where the blood, blood cancer, tumor cancer are both different. And whenever we have the infection, primarily the doctor would ask for uh, what is the problem in the blood. So they are going to ask hemoglobin, HbTlC, DLC. This machine having almost 20 to 30 parameter which can give in a 30 second. So as it is written here, the 120. So just imagine in a 120 why we are calling, in a 30 seconds is giving the one report. So these are all the instruments are quite costly also. Now we have the another machine. Now earlier the people in a histopathology, what we are doing, we are cutting section, then we are dipping into the dyes. Dye means you can say stain, that providing the color to the tissue. As you know that our body is made up of the single cell, then it's become the multinuclear, multi cells, then finally tissue, and tissue that makes the organ, and organ makes the body. This is a simple definition I'm telling you. So once anything is going to be happen with anyone, so it would primarily the cell would be affected. Suppose somebody having the the buccal smear in their mouth, the person who is chewing the tobacco, slowly and slowly that toxin may cause the damage to the cell. So once the cell damage happens, slowly and slowly is going to the back, and the person may have the cancer. But how do we know? We are going to sample from the mouth, then we are staining into this machine, all right, which giving the seconds, even second timings, within a 1 minute, 2 minute, 3 minute, 1 hour, 2 hour. So particular, there are the different kind of the dyes. When it's going to stain, when we are checking under the microscope, we are able to find that whether the patient having the cancer or not. So this is the machine, staining machine, what we are using nowadays in a automation system. So here, automated identification system, now it is related to the microbiology. As you know, the person, what antibiotics we have to take nowadays. So in Indian people, they have the habit to go to the pharmacy people at a pharmacy store, and they don't want to show to the doctor. They are simply directly taking the medicine from there and then taking. And even the pharmacist is also giving. Pharmacists do not allow to give any medication to any patient. You just remember this one. So primarily when somebody having the infection, that infection we are checking in a laboratory, then we are checking the antibiotic testing also. Do you understand? The drugs which has to be given to the patient, especially the antibiotic, that we are going to check in a laboratory. So all these machine are that. So primarily is find out the infection, type of the infection of the bacteria, then what bacteria, this how this bacteria can be killed. So drug testing we are also doing. So we want to find out particular drug for a particular bacteria. So once we found it that this bacteria can be killed by augmentin, tobra, piperacillin, or gentamicin, or azithromycin. So once it is killed by that, then we are going to write it, and doctor is going to prescribe it. So just imagine because every single drugs, once somebody is taking without the diagnosis, is going to damage the whole body. Is going to damage. Even if you are taking the paracetamol for 1 week, it can damage the liver. It can causes the enlargement of the liver. So now coming to this was the microbiology. Earlier was the histopathology and hematology. Now this is the blood bank system. You know how the career opportunities in this one, as this person is going to give the blood 350 ml or 450 ml, out of that we are making the component means the patient what they need. We can take the cells out of it, blood cells, pack cells, plasma we can take, platelet we can take. So this was the technique, and still we are doing the same here. We are taking the whole blood as it is, which is in a body. We are taking the whole blood, and from there in a laboratory we are making the different component, right? Now we have this machine. What is the role of it? You may see the so many things are there. So if I need a one particular cell, your body having the red cells, white blood cells, and the platelet, I think very general it is, everybody knows nowadays. So now if I need for the patient platelet is that cell which inhibits or which stop the bleeding. Do you understand? So if somebody having the bleeding is happening, there are the patient is bleeding from every side of the body, bleeding is not stopped, he may die, he or she. So at that time the platelet may be required in case of the dengue. So platelet, now these facilities are available in a blood bank, that we can take the platelet, rest of the blood we can send back to the patient donor's body. If we need a red cells, we can take the red cells, rest of the things we can send back to the body. And if you want plasma, another, है if you want plasma, so we can take the plasma, rest of the things we have to send back. So through these techniques nowadays, there is no wastage of the blood. If you have collected the blood, we process the blood, right? And after collecting, once it is not utilized, you have to discard the blood. So to check that, now the scientific system, they have given the one machine through which what the components you need out of the body, just take it and give it out to the patient after checking all the tests. So this is called the blood bank. Now here we have the one molecular techniques. You know, in a COVID time, what was happening? No one knows. There was no technique available throughout the world that how to diagnose which kind of the virus it is. Then slowly and slowly, the laboratory professionals and the researchers together, they made a one machine. They made a one technique. Then the same technique has applied on a automation system of the RT-PCR. Then we are able to know that what is the problem with the patient. Technique was already there in the market, but how the reagent to be prepared, how to check that things or the reagent what we need to in an automation system, that was not available. So primarily the reagent design was done, and finally they have added into the machine which is already available in a market, but the people do not know. So how these things are coming up according to the demand. So this is called the molecular biology. How this molecular biology deals with, for instance, somebody is fighting for that this baby is not belong to this parents, and sometimes the baby having some genetic defects like autism. How do we find it? This is the technique through which we can find it. And if you want to find out that how many DNAs, what is the defects in a DNAs, and how the Parkinson disease or the some genetic disorder is happening in a baby. So this machine is helpful in a diagnosis of for that. Sometime what is happening, why it is required, if you are giving the medications to the patient and the patient having the genetic defect which cannot be repaired with the medicine. That's why if you know that what is the defect, then the treatment would be different according to the molecular. If the genetic defects are there, it cannot be treated with the medicine. It has a different treatment, right? So किसी का अगर bone, if there is a bone marrow problem is happening in a one patient, and we are giving the medicine, doctor are giving medicine, nothing would be treated. So primarily they need a stem cell therapy. So they would know only through molecular technology. So hope so that you are able to understand that what I'm trying to say. So now Indian diagnostic industry is how much? You just imagine. I'll go very little and very fast in this one. Hospitals having the 30%, 37. Standards centers and standalone centers we have 47. And diagnostic chains we have 16%. Diagnostic means like Lalpath. Now they have the so many laboratories throughout the world and internationally also. Dr. Dang, Metropolis, what they have? They have the chains. So the businesses nowadays is the increasing, that is the chain. So earlier it was 16%, now it has grown to the even 20%. And slowly in India we have very less, but now it is reaching to. So they are the hospital where the laboratories was there. Then the people have opened their own, almost 50%. Now the chains are coming up. So slowly the market is increasing. And as the market would grow, definitely there's a requirement of the laboratory professionals. Who are they professional? Who they need? They need only the DMLTs, BSc microbiologists, biochemists, right? So all these people are required to this big industry, which has a different kind of the streams: microbiology, hematology, histopathology, etc. So in a one laboratory, at least if somebody is going to open it, we need 10 to 15% at a one place. The diagnostics sector is almost in India and outside it a huge business is there. There are the three different kind of the laboratories nowadays. Routine test, where the common test we are doing, like HIV, pregnancy, pap smear, and a clinical lab monitor the disease and drug treatment both. Drug has been given, patient is affecting or is treating the patient or curing the patient. If it is not happening, then again we have to check it. So what is the progress after giving the medicine? It is again checked in a laboratory. So medical laboratory doesn't mean the primary diagnosis. In some cases, almost 50% cases, if the diagnosis is done, treatment is started, now the doctor would again ask for the test. Reason? They want to see the improvement. Because you are not sure the drugs which has been given it is 100% targeting the disease. No, it cannot be possible. So especially test genetic, tumor, or bone marrow cancer. There are so many cancers around the world is there. So all these are basically done in a oncology. Then endocrinology. Endocrinology, diabetes. If simple example. Nowadays, the girls having the so many cysts in their breast, and the age is hardly 17, 16-year old. Recently, now the menstruation has been started just because at the age of 10, at the age of 11. Reason? Because their endocrine system has been disturbed due to the environmental factors, due to so many drugs, so many toxins in a food what we are taking. So it has been changed. Whatever the fruits we are taking, whatever the vegetables we are taking, it may contain some injection, hormonal injection, that reaching to the human and causing the problem to the human also. But who has to stop? Recently, you might have get some news that there was a duplicate paneer the people are making. Milk is there, and vegetables. It's a very brinjal is very small. In the next morning is a big. How it is happening? Because of the hormone. Whatever the hormone is injected, that hormone we are getting and causing the problem. So endocrinology is leading is a that it is done in endocrinology system. We want to know what is the hormonal status. Infertility is increasing. Reason behind endocrine disorder is there. Infertility, testosterone, luteinizing hormone, so many hormones we are checking. Why it is happening? Because of this. So this is done all in endocrinology and critical segments we have. So just imagine, and these are the some our machinery system, how the laboratory professional they work abroad also and India also. So as if I talk about that, we have the very good placement. Not only the few, this is the one examples I have taken. The very good in a that RCM biochemistry people, microbiology people, almost 8 lakh rupees in a different sectors. And what is the opportunities that I said? It has a very diverse condition, diverse kind of the job opportunities. Biomedical scientists they can become, right? Hospital they can go, clinical research they can go, they can develop the kits to do the test: HIV, HBsAg, HCV, and pregnancy test. How this kit is to be prepared? Now almost lakhs of the kits has been used in a market. Who are going to produce it? They similar the same person, they can go in a development of the kits unit also. Quality control also, whether this laboratory is producing the quality reports or not. There are some person who has done the NABL accredited training also, and who can become after the BSc they can become the quality manager. Compliance report, they want to intellectual properties, if they want something new, if they have invented something new, their property rights also, process and the products all they can. Now these are the people who are taking the sample, doing the testing also, doing the drug testing also. And if the patient or the doctors are facing any problem, they are going to tell to the researchers as well as the diagnostic people. then they try to make a techniques to overcome of this kind of the problems. This is called the, the process and the product development. If the demand is there, then they make a new kind of the drugs. As it is happened in a COVID, no one has the kit, but the people have made because it was required immediately. In a same in a pharmaceutical company, these people can, for in a pharma, if you are making drugs, it has to be sterilized properly, whatever the liquid or the any kind of that. So there the microbiologists, clinical microbiologists are required to check it. Research laboratory, diagnostic lab, entrepreneurship. Now in this field, what is the good thing? If the people have not getting the job as per the scenario, so they can at least start their own entrepreneurship work, or they can open their laboratory. Now as entrepreneurship, all the people, they can set up their own laboratories also. Now here the higher education, the people can go up to the PhDs. Now all these people having the different career opportunity, they can start with the small laboratories, little bit big. Okay, they can have their specialized laboratory. They can go in a teaching profession. Person who has started with the after 10th DMLT, they have going in a higher degree, and finally they can become the professor, assistant professor, the teacher in different colleges. Almost, if I'll tell you, in a Punjab, almost in almost all the universities, all the private institution universities, are almost 80% students is are where they are placed as the associate professor or assistant professor. So this is the one good thing, that the people not only opening their labs, they are going in a higher education also. So as such, the people may have the confusion. Sometimes they ask the question whether they can do the signature over the report. As I said, the DMLT, they are not authorized. BSc MLT, up to the some extent, they can do the signature on a routine laboratory. I talk about the routine test, so they can do the signature. But if they are the masters at the PhD, है so they can do all the signature as a clinical biochemist and clinical microbiologist, not on a oncology where the histopathology report, or in a So this is the one registration and the approval. As we have the now National Health Commission for Healthcare Professional 2020, this has been approved, and now the registration start at the central level also. If somebody is going to ask where we have to register, so after doing all these degrees, we can register, except the clinical embryology. Clinical embryology has the different kind of the domain. So the placement, I already talk about that. These are the some placement companies who are recruiting them. So we have the alumni outside also, good hospitals also, Path also, Apollo hospitals, so Fisher Peckle. So we are these all students are out. Even just, it's a kind of proud that one our student Froj, who has done the masters from here, now he's become the postdoctoral fellow, and he's making the, the vaccine over the pneumococci, the pneumonia bacteria which causes the pneumonia, is making the vaccine over it. So these are all our student who is doing the excellent job in a different areas, government sector also, private sector also, civil hospital also, and military hospital also, railway also, Kapurthala, there are the, that RCF, there are also, they are doing. So almost we cannot name the whole. Till the 17 year I'm here, so I know each and every student where they are working. No one is unemployed, not unemployed. That is the one of the good thing. Nowadays, if the person want to go abroad also, we have the opportunities outside Health Professional Council. Through that, they can register, and they have the same kind of the diagnosis, that designation biomedical scientist, this one. So they can become a biomedical scientist in a foreign country also. Our students are there. This kind of the jobs are coming up. And what they need, their basic qualification is the medical laboratory sciences, BSc MLT, and the masters. And if they have the 1 year experience, they have the good opportunities to the outside also, right? So now this was related to the medical laboratory professionals. Now coming to the IVF, it's a new laboratory, as you know, that in India, very fastly growing with the infertility, almost 15% in a Punjab. Very critical condition. In the days to come, it's going to be increased because of the our system, corporate system, or their the endocrinological system, stress system, that are leading to the infertility among the couples. So that is the one reason. That's why this is a IVF is basically what? IVF is a basically where we are taking the semen or the sperm of a person and the oocyte or the egg from the mother. And in a laboratory, this kind of the labs we have. So this you can just see, this is the one machine where our person are doing together. This is our own machine, the photograph is the same. So on this machine, we are just taking, this is the one egg. You just imagine this is the one egg. And here, this is the one hand from this one. He is holding the one side of the egg. Okay, this is the mother egg, what we have taken when the ovulation is happening during the menstruation. So now this is the needle in which what we have taken the sperm. So this sperm has been taken and then we are inserting into this oocyte. So now it's become the fertilized. So this is the one techniques high kind of the demand is nowadays. Ultimately, once it is grown, then this kind of the development would happen after the fertilization. This is which is happening usually in a normal in a mother's womb. Now it is happening in a outside of the mother's womb, right? So now this is the where we have done. We are just checking the stage. Once this is the one blastocyst stage has been reached, after that we are handing over this blastocyst, very very sterile condition we need for this one. So they are wearing all these things, that's in like a operation theater. So that now this once it is fertilized, we are going to hand over to the gynecologist. Gynecologist is taking it out and putting into the mother's womb. Now this baby would grow in a well condition. Similar condition, only what we are doing in a laboratory. The sperms and the egg has been taken. We are inserting, right? Nowadays the people having the so many habits. Girls are even smoking, and the pollution is also there. Sometimes what is happening when the spermatozoa is going, that there are the cilia which carrying the spermatozoa, but the cilia damage just because of the smoking or the drinking. That's why this problem is growing day by day. So here is in a laboratory that we are taking the both together and we are making the fertilize. After this, we are handing over to the doctor. Doctor is putting this fertilization egg into the mother's womb. Now the baby would develop in a normal way. Hope so that is very clear in a simple in a 1 minute to everyone. And a cryopreservation means sometime what is happening, the person in the army, they are going to the at front of the fighting. Now they don't have the chances of survival, sometimes they die. So they can give their the semen, we can preserve it, we can preserve the egg also if somebody have the cancer also. So these eggs we are preserving into this machine container. And suppose the husband died in a military fight or any other reason, so they can ask the semen and the mothers can get the pregnant. So this is the one good things kind of the scientific system we have. So now the another thing that optometry. So in a simple language, I tell you, optometry as the we are wearing the specs. So this specs primarily it's making the frame also. It has a lens also, and checking the how much is the person having the eyesight. So all these the work of the optometricians. That's the person. Even the doctor also check. But the putting the once you are going for any checking of this glass, they are checking that what is the that sight, they are checking that number. So they optometrist having this one starting from the checking the eyesight, then they are making this spectacles and providing to the patient. So while they are working in a laboratory, they have the lot of work. So ultimately how they become, so they are checking everything. As you know that the patient is coming, they are checking ocular lens, somebody people want the new lens also. So along with the doctor they can learn all these things, okay, that how to check it if the infection is up. The people are nowadays on a computer, on the gadgets throughout the day. So that's why the problem is happening. So career option after the BSc optometry, master degree and the PhD, optical industry, the person who is making this one, the contact lens industry, ophthalmic equipment industry, right? Teaching also, and then a private hospital, private clinic also, own practice also. The people can open their own clinic of the optometry. Nowadays, the people almost in a 160%, almost out of the 100, 15 to 20% they are wearing the specs. So that's why the industry is growing fast. They required it. Now in a higher education, as I told you, the MBA, public health, MSc, all these can do in a vision science, clinical optometry, and a master of optometry. Optometry related to the spectacle, that preparation, the checking, the eyesight related, eye related, all the problems, the people who deal with it, or making the this spectacles providing. This is known as the optometrists. So multinationals companies we have throughout the world, so the people are, this is the work of the optometrists, that they are checking, they are participating in the camps also, checking, and they are providing the solution to the patient who have the eyesight issues. So on practice they can do teaching also, etc. So now coming to the another one, that we have the operation theater technology. As you know, this is the one that here the person here the lights are there, so we are making the similar kind of the theater in a LPU also, okay, and the same this thing anesthesia also. So the anesthesia we required this one, that's why I'm calling it operation theater and the anesthesia technology. They are the teams which are providing the anesthesia. This is related to the anesthesia. Anesthesia, there, just look here. How much we have give the chemical so the patient become unconscious. It should not be given more. It should not be given less. Otherwise, the operation is going, the patient wake up. And if it is even less, even given more, the patient may die also. Okay, so primarily they are checking along with the they are doing the checking, primary checking, that how much it is need. So after that they decide that how much the amount of the anesthesia we have to give to the patient. And what is the operation theater technology people do? They are basically checking once the operation is started. Now, doctors are not supposed to talk too much. They are wearing the mask. They have to just blink their eyes and then they check. Now, the person who is dealing with the operation, for example, if they are going to do the open heart surgery, for open heart surgery, what are the instruments we require? The operation theater technologists, they have to make the arrangement for it. And how many instrument has been utilized? The same instrument has to be packed again once after the use. They check 1 2 3 4 5. Why? To avoid, sometime we listen the news that the one instrument or the gauze piece or the the seizure remain inside the body. So that's why the operation theater technologies person, they are basically checking each and everything before and after. Once they have started, before the start they check, they have to do the counting of it, and after the operation done they have to take it out and the suturing done, and the finally the patient going to the another area. So this is the how the one person with the operation theater technology, they have to be remain there, they have to arrange each and everything, and they have to provide each and everything along with the anesthesia people. So there are the whole team, without that they cannot do. So the technologies in a OT different, anesthesia is different, and the team of the surgeon, which are the doctors basically, they are. So the operation theater technologies person, they are not supposed to do the operation. They are not give the incision. Everything to be done by the doctor, but at least at that time they have to provide each and everything. The incision given, give the blade, surgical blade. Now after that, what they need a scissor to open it. So everything they have to provide. So they are not speaking, because if they are speaking, the patient can catch the infection because it's open. So that's why this is the one training, the one after one. Appendix, brain surgery, or spinal, or amputation, wherever the things are required, they are trained in all. For every single surgery, different kind of the pack we required, pack related to the surgery. How many scissors, how many surgical blades, how many other kind of the things required in this one. So everything is different. For so pack is coming, technologies they have to check each and everything. There should not be any deficiencies. So the career opportunities are high in this one also. For here this one, that we have the courses. Okay, so the person who is going to work, they can work in a almost private, government, as well as the outside, in an international, anywhere they can work in that. So these are the surgical assistant, clinical researcher, sterile processing of the technician, outpatient surgery, and the lab technician. These are the opportunities in that. So area of the employment for BSc operation theater, you just see all these: research institute, then specialist clinic, crisis management, emergency resources. So documentation, observational skills. It's not an MD doctor is going to do, or the surgeon. It is to be done by the associate person. So this is the team, not a single person. So all these things are done by the operation theater people. So as you know that the glass part simply, that the operation theater, optometry, laboratory professionals, and embryology. So this is related to the all these profession. In a brief I talk about, hope so that you are able to understand. So that's all from my side, ma'am. Thank you so much.
Thank you so much, Dr. Naresh Kumar. And now I would request to our admission nominee, Mr. Bhuvan Sareen, to be on the screen. Over to you, Mr. Bhuvan Sareen. Yes.
My screen is visible, no?
Yes, the screen is visible.
Yeah, thank you very much. Sir, it was an insightful session, specifically for the programs in sciences, because majority of the students are looking for a few programs only, like they want to go for programs in engineering, or they have a occupied mind. But now with
Mm,
this, they will open up that there are plenty of options available for them, and they can choose
mm.
the best option available for them. Thank you very much.
Yeah,
Now,
thank
for
you,
all
sir.
the viewers who have joined us in this session, I just want to take you to my website lpu.in quickly. So once you go to my website lpu.in, you will find out all the details which are visible for you for your kind information. Now, recently, one of our students got a package of 2.5 crores. That is the highest package among very few private universities will be able to offer. So you'll hardly had any opportunities from a universities that a student is getting 2.5 crore package. So that is a good achievement from the university. Even we have a lots of students who are getting a package of 1 crore, 63 lakhs, 50 lakhs. That shows the efforts behind the placements. So we have a dedicated division in this university who are dedicated team who are working for the placements. So that is the reason that we are able to get the better placement opportunities in this campus. Other than this, we have good ranking. I like just want to take you to the rankings part. For NRF, we are 27th among all the government and private universities in India. World University ranking, we are among the ninth. The World University ranking for the innovation, we are on fourth. And the impact rating 2024, we are the second in terms of all government and private universities in India. Other than this, we have 2025 recruiters hired the university student. That is a huge amount of, you can say, the students, no, recruiters coming to help you for this. 6,000 plus offers from the Fortune 500 company. These are the company which actually goes to the IITs or top brands in India. They are coming, the same companies we are putting out to grab the students from LP itself. And the bigger highlight is 25% students, the top 25% students who are placed, they are getting a package of 10 lakhs and above. That is a good achievement. And this
Mm,
shows that the students are getting a quality package from university. As I have already informed you, that we have a recruiters, 400 plus recruiters who are actually going to IITs, IIMs, NITs. They also hire students from LPU itself. So that showcase the impact of university and their programs. Now, in case you are undergraduate and you want to join us in any of the programs offered by university, then you can go ahead with this and you can join us and you can find out all the programs details which are available here. Now, in case you want to go ahead with the programs, you want to go, I'll just take an example for this applied medical, then you can go ahead with this. B Pharmacy program is also available. In case you want to go ahead and you want to find out the details, this pharmacy program, you'll find out the eligibility, you'll find out the curriculum, you find out the scholarships labs, and the major highlight. I just want to tell you about this study in LPU is that anybody who's because recently the boards have completed their examination and we are expecting the results to be out within next 30-40 days. So in case anybody who's being the top 20 rank holders from the education board, if you are from any board and you are among the top 20 board holders, rank holders, you'll get 100% scholarship to study in a university, including the hostel. So that will give you a better opportunity that you are getting 100% scholarship to study in our university. So the program fees will be nil. And along with this, if in case you are getting 98% and above marks in your class 10, or you are getting the same marks in your class 12, then you will be getting 60% scholarship. The fees will go down to 48,000 per semester. Similarly, for category B scholarship, in case you are getting a 90 to 90% marks in your class 12 or a 10th, then you'll be getting 50% scholarship. The fees will go down to 60,000 per semester. Similarly, if you are getting 90 to 94% marks in your class 12 or 10, the fees will go down to 72,000 per semester. And board percentage in your class 12 and 10th, if it is 80 to 89.99, the fees will go down to 84,000. In case you want to improve your scholarship, then we are having LPUNES examination. Same in case you are getting LPNS examination, you qualified well, then you can score any of the scholarship. So it is either on the basis of your LPNS examination or your board percentile, or in case you are happen to be the board topper, you will be getting scholarship to study in LPU. One more highlight about LPU is that once you got a scholarship to study in LPU, that scholarship remain for the duration of the program. Whereas majority of the universities, they will offer you a scholarship for a first semester, but second semester they do have a cutoff. Like I say, there's a cutoff of 80%. If you're not able to maintain 80% marks in your first year, then they will cancel your scholarship. This is not a case in LPU. Once you got a scholarship in LPU, you are confirmed that with the tenure of the program, you will get the scholarship. That is the main highlight of scholarship, which other private universities you might not be able to find out. So other than this, if you find out the opportunities, you want to grab it, you want to see the placement opportunities. Yes, for this particular program, the average salary package is 8.4 lakh, and then 150 plus dream offers, 40 plus recruited for a pharmacy programs only. And if you want to highlight the NRF ranking for my pharmacy program all over India is 16. So that showcase the efforts made by the pharmacy department in India from comparatively the other Indian universities. So we are 16 in that ranking. So other than this, we have 1300 plus research paper already published, book chapter 2130 plus, patent 460 plus. These are the main highlights which you might not be able to find out in any other local college or any other universities. So this shows that my research in this program is very strong. So in case you find out any program other than this, you want to allied programs, you want to go for any of the programs, medical lab technology we are offering. In case, let's take an example of optometry. In case you find out, you will find out the program packages, NRF rankings, or as per those particular programs only. So this and scholarship remains the same. In case you are having your board percentile 98% above, or in case you have to be the board topper, you'll get out the scholarship. So this is the main highlights of studying in LPU. In case any of you having any doubts related to any of the program, you are most welcome. And one more thing, I just want to add on that LPU recently we have opened up our offices nearby your city only, or you find out that LPU office is in your hometown only, or it is nearby your city only. So it is very easy to find out to locate LPU office in your town or in your city only. So in case you want to go ahead with the 360-degree view, we have a link. You want to schedule a call, just let us know. Our team will call you. You want to have a WhatsApp chat, the option is available. You want to have a video conferencing. This is very unique feature offered by university. Sometimes the students are involved in the decision making, but sometimes they miss the parents part. So in case you are not able to reach us and you want to have a counseling session or a video counseling, you can involve your parents also. Let us sit together along with your parents. Let's have a video counseling with the experts, and they will give you the entire idea. So this will be a good feature. You can get the advantage. And in case you want to visit our local office, we have opportunities nearby. So in case you want to go ahead, you have this option. Even if you are coming from Andhra, suppose you are from Andhra Pradesh, we have an office in Guntur. So you'll find out local team member who's a responsible person having this of East Godavari. So you'll find out entire India. Even if you are coming from Manipur, the state, we have this office, we have a representative there. So you can contact any representative, even you're from Rajasthan, whatever city is nearby you, you find out the people who are available nearby your city. You try to take appointment and visit them and meet them along with your parents and get the idea about the university, the scheme, the syllabus, and the opportunities for your better career. So other than this, in case you have any doubt, any questions comes to your mind, you are open to discuss. Thank you very much.
Thank you so much, Mr. Bhuvan Sreen. Can you please stop sharing your screen? Can we take the questions, Dr. Naresh Kumar and Mr. Bhuvan Sreen?
Yes, yes, we can.
Thanks for giving me chance to address your questions. Now let's start with first question. Gurpreet is asking here, what are the most in demand career paths in allied health sciences today and what qualifications do they typically require?
So basically, in this one, of course, the medical laboratory sciences is quite good one. Reason behind, because it has almost 10 to 15 laboratories nowadays. Hematology, histopathology, biochemistry, cytology, and pathology. Different laboratories are there. So BSc MLT is only required, and because of the diverse laboratories are required, the in a one laboratory. Suppose, for instance, if I'm doing physiotherapy, I have to go in a physiotherapy. But here the laboratories are too many. In a single laboratory, we cannot perform all the tests. That's why the person who has done the BSc medical laboratory, they have the chance to place in a several laboratory, which is the part of the same BSc medical lab sciences. That's why the BSc medical laboratory having the high chance other than a specialized. Now, if the person is become the specialized in a master, that is the different. But high demand is why? Because of the complexity of the test, because of the complexity of the diagnosis, BSc medical laboratory professionals nowadays in a high demand.
Thank you so much, Dr. Naresh. I hope Gurpreet you got your answer from our expert. Mr. Bhuvan Serene, someone is asking, do LPU provide the residential facilities also?
Yes, yes, we do have residential facilities available in the campus. We have categorized the hostels in categories like we have apartments, we have hostel rooms. We started from a single, second seater, three seater, four seater, and it goes on. So as per your convenience, and you can opt for the hostel facilities. And we have a mess inside the campus, fooding facilities also there. We have a kiosk, we have a sports facilities, indoor stadiums. So we have lots of facilities for our students.
Thank you so much, Mr. Bhuvan Serene. Megha is asking Dr. Naresh,
Yes.
what are the growth prospects and global demand for allied health professionals in the next 5 to 10 years?
So I would say because of the complexity as I already talked about, it is high demand. Reason now as we are taking the drugs causes the damage to your body, right? That's why what the people are asking, what the government is going to do, it is compulsory. First is the diagnosis, then test, that finally the treatment to be started. That's why without test, you cannot go for any treatment. Worldwide wide is increasing. As you know, the complexity would increase, the demand of the laboratory professionals would increase, right? As the newer things are coming up with the AI, that's why the persons are required more in this field to operate the system for their application to diagnose the proper diagnosis of the diseases. That's why it is in a demand. It would remain.
Thank you so much, Dr. Naresh Kumar and Mr. Bhuvan Serene. I hope all the participants got the answers from our experts. As we come to the end of this webinar, I want to express my deepest gratitude to our experts for sharing their valuable insights and expertise with us. Your presence, enthusiasm, and active participation have made this experience truly special. Hopefully, the attendees found this webinar to be valuable and will be able to utilize the information for better decision making regarding admissions. If anyone wants to access this webinar again, they can visit our website that is lpu.in or can be accessed on YouTube also. Stay connected with us for future webinars. Until we meet again, with the permission of my seniors, I would be signing off this webinar. Take care and goodbye. Have a beautiful day.
Okay, ma'am.